One of the questions that comes up among young women is, am I high risk for breast cancer? In 2018, the American College of Radiology issued new recommendations that all women be evaluated for breast cancer risk by age 30, so that those at higher risk could be identified and begin screening before age 40. Similarly, the American College of Breast Surgeons advises all women over the age of 25 to undergo risk assessment. So there are two questions that we need to answer. Number one, what is the definition of being high risk for breast cancer? And number two, how do we calculate risk? Being high risk for breast cancer is usually defined as a more than 10% risk of harboring a predisposing pathogenic mutation or a 5-year risk of developing breast cancer of more than 1.67%. One of the methods for assessing breast cancer risk is known as the IBIS or Tyrer-Cuzick model, which you can access online at this website. It has been shown to be the most consistently accurate model for predicting the risk of breast cancer. Contributing factors include age, height and weight, age at first period, age at first live birth, use of hormone replacement therapy, BRCA1 or BRCA2 mutations, history of ovarian cancer, previous breast biopsies, and Ashkenazi Jewish ancestry. The most commonly used risk assessment tool is called the GAIL model, which takes into account age at first period, age at first live birth of a child, the number of first-degree relatives such as mother, sister, and daughter with breast cancer, number of previous breast biopsies, whether positive or negative, and the presence of atypical hyperplasia in a previous biopsy. While this model has been validated in Caucasian women, it may actually underestimate risk in other ethnic groups, and it can be accessed at this website. A third model, known as the BOADICEA model, standing for Breast and Ovarian Analysis of Disease Incidence and Carrier Estimation Algorithm, was designed using segregation analysis in which susceptibility is explained by mutations in BRCA1 and BRCA2, as well as a polygenic component that reflects the multiplied effects of many different genes, which individually have small effects on breast cancer risk. This model can be accessed at this website. Because it's clear that some models are better than others in certain circumstances, here's a flowchart for selecting a breast cancer risk assessment model in the clinical setting. If the patient has no family history of breast or ovarian cancer and no hormonal or reproductive risks, you can use the IBIS model for risk assessment. This model can also be used when a patient without a family history of breast and ovarian cancer has hormonal or reproductive risk factors, as well as benign pathological risk factors. Hormonal or reproductive risk factors refer to a couple of things. Number one, prolonged exposure to endogenous estrogens resulting from a first period before age 12 and or late menopause after age 55. Number two, use of an oral combined contraceptive pill with increased risk during use and for 10 years after discontinuation, use of combined estrogen-progestin hormone therapy with an increased risk during use and for 5 years after discontinuation, being over the age of 30 at the time of your first live birth, and never having breastfed. Benign pathologic risk factors refer to a couple of things. Number one, lobular carcinoma in situ. Number two, atypical ductal hyperplasia or lobular hyperplasia, proliferative hyperplasia without atypia. If a patient has a family history of both breast and ovarian cancer, the BOADICEA model can be used for risk assessment. For patients with a family history of breast but not ovarian cancer, if the history is only in first-degree relatives, the IBIS or GAIL models are used. In these patients with breast cancer affecting more than first-degree relatives, the IBIS model is used if they have any other risk factors, with the GAIL model being used if they don't. While these models quantify a patient's breast cancer risk, you can also use family history to more broadly categorize your risk for breast cancer. The U.S. Centers of Disease Control have specific definitions for average, moderate, and high-risk categories for breast cancer, which can be seen in the table here.